Hello and welcome to our session on a recap of pharmacokinetics and pharmacodynamics. If you've already done pw2002 last year, this will be a recap for you. You might already be associated and understand some of the key pharmacological principles that we're going to look at today, but it's always really good to have a recap because it is going to form one of the key aspects of our assignment this year. If you are new to pw2002, this should give you a really good basic understanding of some of the key concepts that we looked at last year, and it'll help you to understand what we're actually talking about when we're talking about pharmacokinetics and pharmacodynamics. So the aims of today's sessions, as I said, we're going to look at a revision of the key pharmacological principles. So we did identify some of those last year for those of you who did do the module last year, but that doesn't mean to say that anybody's going to be behind if you didn't do the module last year. There is a really good resource here. Obviously there's lots of resources that I'll talk us through that are available as we're going through. And we've also got some really good videos. Now I'm not going to play the videos as part of this video presentation. What you will have to do is to click on the PowerPoint link, which is also within Blackboard and Teams and the OneNote, and then click onto the videos to actually watch them in your own time. So I hope that's okay. So the second thing we're going to do is we're going to be thinking about discussing the application of some of these key pharmacological principles in the seminar this afternoon, having a look at what this actually means for you, and potentially if you've already thought about choosing your medication, your chosen medication. And then, as it says, we're going to explore the module learning outcome 2 in a little bit more detail and how we can link this to your chosen medication. So the discuss and the explore, they're going to be more in this afternoon's sessions when we have the seminar, but the revision session is going to really be within this morning's presentation. So linking to your assignment and the module learning outcomes, so we're looking specifically at learning outcome 2, and this is apply the fundamental principles of pharmacology in practice. So this is actually looking at a discussion to the medication that you've selected. So as we said in the assignment guidance presentation, for learning outcome 2, you'll need to discuss the relevant pharmacology of this drug in the terms of the fundamental principles. So the things that we're going to be looking at are the pharmacokinetics and the pharmacodynamics of the medication. So what does the drug do to the body, and what does the body do to the drug? Another key pharmacological terms that we're going to have to be looking at in relation to your selected medication are processes like absorption. How is the medication taken into the body? Is it taken in orally? Is it in an injectable? Is it taken in as a topical administration? What actually happens to it when it gets into the body? How is it broken down? How is it metabolized? Is it metabolized within the liver? Is it metabolized somewhere else in the body? What does this actually do to the medication? How is it actually distributed around the body? Is it topical, so we're just applying it to a particular area? Or is it distributed around the body through the cardiovascular system? And then how is this medication excreted? Any waste products that are created, or the actual products of the metabolism of the medication, how is that excreted? Is it excreted through the renal system? Is it secreted by the liver? How is it actually got rid of by the body? So there are lots of key things that you need to be thinking about when we're thinking about learning outcome 2. This presentation is going to look at some of the key introductory terms of pharmacology, and it's going to be looking at the generic stuff. Whereas obviously for your assignments, we need to be looking at it specifically in relation to your chosen medication. So just a couple of definitions to throw at you. So as we said last year, or if it's new for those of you who are joining me for the first time this year, with the key things that we're going to look at when we look at pharmacology is the pharmacokinetics and the pharmacodynamics of medication. But what does this mean? So pharmacokinetics is what the body does to the drugs. So for almost all drugs, the magnitude of the pharmacological effect depends on its concentration at its site of action. So what this means is, when we take a medication into our body, if I take a tablet, what actually happens once it goes into the body? Before the medication has even had time to think about doing anything to the body actually starts to affect the medication that you've chosen. If I take a paracetamol, I take it generally through my mouth. It's an oral tablet. I take this medication through my mouth. Now, I know quite a lot of us have probably taken a paracetamol, and I'm not sure, unless there's one of you out there, of anybody who actually likes the taste of paracetamol, if you actually start to break it down in your mouth before you've actually swallowed that tablet. But what's actually happening as we're taking this paracetamol tablet into our digestive system? So what you might have to do is to go back and to look at your anatomy and physiology notes from last year, and to think about what is the digestive system, what is the key function of the digestive system, what happens within the digestive system as something which is taken in through the mouth passes through. Because this is going to be the key thing that happens when we're thinking about the pharmacokinetics of a medication. So if I'm taking an oral medication, it goes into the digestive system and down into the stomach. Is it broken down in the stomach? Is it broken down in the duodenum or the small intestine? And where is our medication actually absorbed into the circulatory system of the body? When it's taken into the circulatory system, it's generally absorbed through the small bowel. As we learnt in anatomy last year, the small bowel is the main source of absorption into the body, whereas the large bowel tends to be the absorption of water and then the creation of a stool. So when we're thinking about this, what happens when our medication is broken down within the digestive system and then absorbed through the villi and the microvilli of the small intestine into the circulatory system? And then what happens moving on from that when we're thinking about the first pass effect? Is it affected by the first pass effect? All absorbed nutrients from the small bowel, the first place that the blood which is running alongside the small bowel goes to after it's left the small bowel is actually the liver. And so this is where our first pass metabolism occurs, and we're going to look at this in a little bit more detail as we go through this presentation. But really the first part of our pharmacology is the pharmacokinetics. So what does the body do to the medication once it's got into the body? And once we've got past that point, once we've got to the point where any effects that the body's going to have on this medication have occurred, we then get into the pharmacodynamics. So what does the drug do to the body? What happens to that medication when it actually gets to the place that it's going to work on? Is it working systemically? Is this medication getting to every cell within the body? Or is this medication specifically going to act on one particular area within the body? And that's really what we're thinking about when we're looking at the pharmacodynamics. So if we recap, the pharmacokinetics is what the body does to the drug. So the effect of the body on that medication that's just been taken. And pharmacodynamics is what the drug does to the body. So once any of the pharmacokinetic actions have actually occurred, what actually does the medication do? Why are we taking this tablet? What is our hope that this medication will actually change or cure or cause? So as we said, pharmacokinetics. So pharmacokinetics involves the study of the route. So routes examples, as I said earlier on the previous slide, we've got oral, it might be parenteral, it could be inhalation, it could be given rectally, it could be given transdermally, or it could be given as an injection. When you are thinking about your specific medication that you're interested in, you've got to think really about how is this medication, how does it get into the body? What is the route? Because that's going to have a really key aspect when we're thinking about the pharmacokinetics of our medication. So taking on from that, we've got to think, how is it absorbed? So is it absorbed through the digestive system, as we said? Is it taken in because it's inhaled? It's absorbed into the respiratory system. That's going to have a different effect upon the body than something that is taken through the digestive system, because it's going directly to the area that it wants to affect. Whereas if I'm taking an oral medication for a pain in my toe, it's got to then travel systemically to the area that it wants to work on. So again, absorption is going to have a key effect on our pharmacokinetics of our medication. We then might be thinking about our first pass effect. If we are taking our medication orally, is it affected by the first pass effect? The fact that it goes through the liver first before it affects anything else. And as I said, I do have a little information video later on what the first pass effect is, for a recap or to introduce it for the first time if those people who didn't do last year's module, and actually going into what this means for you. So does it have any protein bound? So some medications have to be bound with proteins before this medication can actually have an effect. An example of this is penicillin. It's very highly protein bound. So again, what does your medication have to do? Does it work by itself, or does it have to actually be bound to other proteins and other molecules within the body before it can actually have an effect? As we said, we're then thinking about the excretion. How is it removed or cleared from the body? Is it excreted in the urine? Is it excreted through the respiratory system? How is it actually got rid of out of the body? We've also got to think about half-life. Now, half-life is something that I always think of, and it always brings to mind like nuclear waste. I think we always think about half-life when we think about, it's always talked about when we listen to the news or we talk about other things, of how long it takes for something to be got rid of. So a half-life is, how long does it take to get to the point of complete no return? So how long does it take for the concentration of this medication to go down by 50%? So if we have paracetamol, we aim to take paracetamol every 4 hours. So 1 gram of paracetamol might be taken every 4 hours. So what this means is that our half-life of paracetamol can take up to 4 hours for our concentration to not be used anymore. Otherwise, we could actually cause toxicity. So the half-life would be, if we say that every 10 minutes or every 20 minutes it reduces by 50, if we start at 100%, 20 minutes later it will be at 50%. 20 minutes after that, so 40 minutes in total, we're now at 25%. After an hour, we're now at 12.5%. An hour and 20 minutes, we're now at 6.75%. An hour and 40 minutes, we're at 3 point something percent. And now 2 hours, we're at about 1 and a bit percent. So as you can see, we've gone from 100% to 1% in about 2 hours if a medication has a 20-minute half-life. So when we're thinking about our half-life, it's really important, and this is what links to our dosage calculations, because it's really important that we understand how long it actually takes for the concentration of medication to reduce within the body. And are there any things that might actually impact this? So we've also got to think about toxicity. Now this might be how much medication we have in our blood. If we keep taking paracetamols, or we take multiple medications that contain paracetamol, we might actually be overdosing. We might be building up a toxicity in the body. But this could link to comorbidities as well. Does somebody have an underlying effect? If our medication is excreted through the renal system, but our patient has an issue with their renal system, or they have kidney disease, could this actually mean that the excretion of our medication is reduced? So even though the half-life is an appropriate amount of time, because it's not excreted out of our blood in the appropriate manner, we could actually still be building up a toxicity because it hasn't followed the traditional half-life and it hasn't been excreted appropriately. So it's really important when we're thinking about our pharmacokinetics to have our key medication in mind so that we can think about some of the important aspects as we're going into it in a little bit more detail. So what I'd like you to do on this slide, obviously as I said, I'm not going to go through the videos on these slides. There's a couple of videos, each one's I think up to 10 minutes long, and they're really good videos that are going to give you a good overview of an introduction to pharmacokinetics and pharmacodynamics. As this video is, I've got a video later on which is looking at routes of administration in more detail and how they're affected or they affect the pharmacokinetics of a medication. And I've also got a video later on looking at the first pass effect, what this is and how this might affect orally taken medications. So it's really important that once you finish this video that you go back away, you have a look directly at the PowerPoint link and you click on the 3 video slides and watch these short videos to give you a really good overview on pharmacokinetics versus pharmacodynamics, routes of administration and the first pass effect.
So when you look at this word
So routes of administration. So as we said earlier on, there are lots of different routes of administration. So we could have a topical, as we said, so we're thinking about topical, it might be a cream that's applied to a certain area, it might be an antibiotic ointment, it might be an antifungal ointment, it might be something like capsaicin cream or deep heat. There's lots of different things that could be applied topically. It could also be a infection ointment for eyes that's applied, or eardrops. So there are lots of different medications that are applied topically. It might be an orally taken medication. This is the most traditional method of administration of medications. It tends to be the most convenient. Tablets are nice and easy for most people to take. It's non-conspicuous, you can take them anywhere. It's not something that has to be done in the privacy of your own area, that a topical administration might be or a rectal administration might be. And they tend to be a lot cheaper to produce as well as orally taken medications because they can be mass produced a lot easier. So oral medication or oral administration tends to be the most common method of administration of medications. So as I said, we could also have rectal administration. It's different medications need to be administrated in different ways. And while rectal administration might be a little bit more invasive, it can be very useful in certain situations. For example, if a patient is non-responsive or they're having a fit, to be able to administer medications, for example, lorazepam via a rectal administration means that it is absorbed through the mucous membranes of the digestive system very quickly because it has a good blood supply and it has a really quick turnaround and metabolization, so it can be really helpful to get it in, especially in situations where a patient might not be responsive to be able to take something orally, and you might not be in a position where an injection or IV administration is appropriate. So obviously we can also have inhalation, so we could be talking about inhalers, we might be talking about nebulizers. So there's lots of different ways, especially if we're trying to directly affect the respiratory system, that an inhaled medication might be the most appropriate method of administration of your medication. We could have a buccal administration, so this is underneath the tongue. Different medications are administered this way. Again, it could be something like lorazepam, which is administered underneath the tongue. There are some diclofenac type anti-inflammatory medications which are also administered under the tongue. We've got GTN sprays, again, which can be administered under the tongue. It's a very quick, again, just like the rectal, we've got really thin, well perfused mucous membranes within our mouth. It's all part of the digestive system, and it's a very, very easy and quick way for some medications to be taken into the body, and it can be very, very useful. We can also have injections, so we can have intramuscular injections going into a muscle. We can have intraosseous injections going into bones. We can have intravenous injections going into our circulatory system, and we can have subcut injections going into the subcutaneous layers within our body. For example, tinzaparin, heparin injections, or diabetes medication injections, insulins and things, which all go into the subcutaneous layers of our skin as opposed to directly into the circulatory system. Excuse me. So as I said, this is another video. In this video, this practitioner goes into more detail about the variety of routes of administration, looking at some positives and some negatives of these, and what they actually mean potentially for when we're thinking about the pharmacokinetics part of our medication admission.
Okay,
So the next thing, or the kind of last thing that we're going to look at in this presentation, is the pharmacokinetics and the first pass effect. So when a patient is taking oral drugs, as we said, oral drugs go through the digestive system, and once they've passed down through the mouth, down the esophagus, into the stomach, they've spent their time with the rest of the stomach being broken down and turned into the chyme to be moved through the duodenum. These oral drugs work their way into the small intestine. So because, as we said earlier, most things that are absorbed through the digestive system are absorbed within the small intestine, oral drugs tend to also be absorbed within the small intestine. The blood supply that runs alongside the small intestine, once it's worked its way running alongside this area, goes directly into the portal venous system, and they're transported directly to their liver, then onto the heart to be passed systemically around the body. So they're going into the venous system, which is obviously the out part. We think about the perfused section, the oxygenated side, which is working its way around the arterial system. This is the thing that's taking the things to the body or to the cells. Whereas our venous system is the return side. This is taking things away from the body, back to the heart, to then be recirculated. So when it goes directly to the liver, something can happen to some medications, and this is called the first pass effect. So as I said, the liver is our key metabolizing area. So the liver metabolizes most of the chemicals or most of the molecules which are within these medications. So actually, a large percentage of the medications that we've just taken are destroyed here. They never actually reach the tissues of the body. And this is what the first pass effect is caused. So when we're thinking about dosages, this is why an oral dose may be greater than a parenteral dose. So an example of that again might be paracetamol. The traditional dose for an adult for paracetamol is 1 gram of paracetamol. However, of an orally taken 1 gram of paracetamol, we might only get 40% of that actually pass through the first pass metabolism and then be transported to the rest of the body. So we're actually only having a very small percentage of the paracetamol affecting the body, whereas the other 60% is broken down within the liver, metabolized and changed, and then excreted. So a patient who takes 1 gram of paracetamol might say, oh, what's the point in paracetamol? 1 gram of paracetamol is rubbish. However, if they actually go into hospital and they're administered 1 gram of paracetamol via IV, they might then report and say, wow, that gram of paracetamol was absolutely brilliant. It took all my pain away and I can't believe what 1 gram of paracetamol can do. And this is because the same 1 gram of paracetamol is started. However, the 1 gram of paracetamol which is given through the IV doesn't undergo the first pass effect. So 100% of that medication, or 100% of the 1 gram of paracetamol, can have an effect upon the body, effect upon the cells. Whereas, as I said, if 60% of the orally taken paracetamol is actually metabolized, the patient is only ever experiencing the pain-killing effect of 40% of it when taken orally. However, this can also explain why a patient with liver problems could have an impact upon taking away, or can have an impact upon the use of paracetamol, because if 60% of that medication is metabolized within the liver, a lot of the liver is having to work hard to do that job. So if a patient either has a very high dose of paracetamol within their body, in the case of overdose, through accidental or on purpose, or because their liver isn't working efficiently, this is when it can cause problems, because the extra allowances or the extra oomph that the liver has to do to metabolize these can cause more damage, or might not be metabolized properly, which can then cause extended damage to the body from toxicity. So another example is that GTN, if taken as a tablet, has a very, very high first pass effect. So to actually get a reaction or a response from GTN if it's taken orally, you have to have a much higher dose, which can put a lot of pressure on the liver. So this is why they tend to have changed to GTN to actually be taken as a spray, as we said, under the tongue or in the mouth, because it doesn't have the same impact of the first pass effect. So a patient can actually take a much smaller dose to get the same systemic reaction, which is going to be obviously a lot better for the patient. There's going to be a lot less risks associated with taking a lower dose. It's going to have an effect upon the body and effect upon the heart a lot quicker, because it's going to be taken and digested. It doesn't have to go through the digestion process. It's taken directly into the systemic circulation. And obviously, like we said earlier, these things, if you're not having to use as much, is obviously going to have an implication on cost. And this is also why injections usually have a better outcome than orally taken medications. So even though orally taken medications have all the positives of being cheaper, easier to use, they're a lot better for self-administration of medications, if a patient has an infection and they've taken a course of oral antibiotics, and these antibiotics don't seem to have got to the underlying cause of this infection, it might be that you are then admitted or put into some kind of support to actually being able to have IV antibiotics, because even though you might be getting the same dose of antibiotics, if you're giving it IV, you're getting 100% of that antibiotic taken into the body. and to be taken to the systemic circulation to help to fight that infection. Whereas the oral antibiotics, you could be losing 50% of it within the first pass effect. So it's quite an interesting thing to be thinking about, and it is really useful that even if you're talking about a medication which is given in a non-oral method, for the case of your assignment, it might be really good to actually give a little bit of an overview on what the first pass effect is and why your medication being given in a non-oral route is actually better potentially for the patient because of the lack of the first pass effect. So as we said, we've got our last little video. This is a really good video that talks you through the first pass effect in more detail. It'll help clarify maybe some of the things that I've just discussed if it's a new concept to you. So you can actually look at what this actually means and how this might actually affect a medication. So linking into our tasks for this afternoon, obviously I'm going to pop the tasks on Blackboard, on the OneNote page, on Teams. So I would like you to recap by defining these following statements. So what is pharmacokinetics, what is pharmacodynamics, what is absorption, distribution, metabolism, excretion and the first pass effect. But what you might also want to do, once you've moved from these particular, just the basic definitions, is to think about your specific medication that you might be choosing. And then start to think about what might be the pharmacokinetics of my medication, what might be the pharmacodynamics of my medication, how might it be absorbed, how might it be distributed, how might it be metabolized, how might it be excreted, and is it actually affected by the first pass effect. So obviously these are quite a lot of detail, but this is really going to form the basis for the answers for Learning Outcome 2 for your assignment. Now I know this isn't something that might be achieved in 1 week's lesson or 1 week's tasks. It's going to be something that might take you 2 or 3 weeks. But by having some thoughts or doing some research into these key areas, you're going to really have formed the basis of your Learning Outcome 2 for your medication. We will be going into these in a lot more detail when we look at body systems and links to your medication later on in the module. But it is really useful to have a think about these as we get going. And then as always, any questions that you have, write them down, pop them on Teams. We'll be having a look at them as we go through the seminars later on. Make sure that you do ask questions. I know pharmacokinetics and pharmacodynamics and an introduction to pharmacology can be quite scary for some people, especially if you didn't do the introductory 1002 last year. So, don't be scared of asking, don't be scared of coming and seeing if you can book a one-to-one with me if you're unsure of any of these topics. Those videos are a really good first look, but do your research, use the resources that I've put out there as well, and really, think about it. And if you are struggling, make sure you book in a one-to-one with me, because I am here and I am quite happy to help anybody, go through them or answer questions or look at any of the key things that they might be worrying about. All right, well, have a nice day and I shall see you later.